leg swelling, which is also known medically as pedal edema, is a very common condition among the elderly population, especially those elderly who are above the age of 80 years old. And in my practice, this is a problem or a concern that I address very, very frequently. When you talk about the different causes of leg swelling, there are many, but what is more crucial to know is that a large majority of leg swellings are actually not due to serious causes and do not warrant significant medical treatment. So if you are an elderly person listening to this podcast, don't panic. I will break down the causes into what is serious, what isn't, how can we differentiate them in a very, very simple and easy manner to understand. So let's dive in. Now, first, what is the cause of leg swelling? And we shall start off with the most common cause, which is fluid retention. Now, fluid retention is due to age-related weakening of the blood vessels in the legs. So how it works is the water in our body circulates in a closed loop, where the blood gets pumped out from the heart, passes through the circulation, and gets drained back to the heart through a series of very effective mechanisms. Now, our body is actually very, very effective, and it's created in such a way where the vessel walls, the valves, the leg muscle contractions, it pumps the water, the fluids back to the heart. Now, in the case of elderly population, right, their vessel walls are often very weak, their valves are not very efficient, and their muscles do not contract as frequently and as strongly as a young person. And because of this, fluid often gets retained in their lower limbs, and most often you see them in the evening after sitting or standing for a long period of time. Their legs start to swell up. And particularly for this cause, medications are typically not necessary. We, however, will usually advise patients to put on a special compression stockings to help drain back the retained water back to the heart. Now, that is the most common cause of leg swelling in the elderly population. However, we also need to understand that there are certain causes which are potentially dangerous. Now, one of them is heart failure. When the heart is very weak, it does not pump blood as efficiently as it should, and therefore water gets retained in the legs. This often happens in elderly patients who have existing heart problems. It could be a previous heart attack, it could be some heart valve problems, or even just simple long-standing uncontrolled high blood pressure for maybe 10-15 years. And one of the telltale signs of heart failure is that it's often accompanied by other symptoms like having shortness of breath, breathing like very difficult to breathe. And this is due to, in addition to the water being accumulated in their legs, the water also gets accumulated in their lungs. And they often feel tired all the time, and usually when they sleep, they need to put more pillows and to sleep at a more elevated height. So usually when we ask these patients, we say, oh, have you recently been adding more pillows when you sleep? And usually they will say, yes, now I'm sleeping with 2 or 3. I'm sleeping literally almost sitting up when I'm sleeping. And other potential dangerous causes are kidney and liver diseases. And for these causes, the patient are usually a bit more younger. They may be in their 50s or 60s. So for kidney diseases, usually the patient have very poorly controlled high blood pressure or diabetes for a very long period of time. For liver diseases, the patient may have a very long history of alcohol intake, may have hepatitis, viral hepatitis, or may have been taking some traditional medicine for a very long time, which damages the liver or the kidney as well. But the good thing is that both liver and kidney diseases can be actually detected using a very simple blood test. Now, in some cases, The leg swelling may be caused by certain medications, especially some high blood pressure medications. And this situation is usually very harmless. The patient will notice the swelling appearing shortly after starting on the medication and goes away upon cessation of the medication. And usually this is something which is very easily addressed, and the patient will usually be able to know themselves. So what I've mentioned so far are with regards to leg swelling of both legs in the elderly population. However, in some very rare circumstances, you have an elderly patient being presented with leg swelling of one single leg. And when they have they have a swelling of one single leg, usually this points towards a more urgent situation. We are more concerned about swelling of one leg than both legs. When the swelling is on one leg, it may point towards an infection, a soft tissue infection called cellulitis, and this is usually accompanied by maybe some degree of fever, pain over the redness area, and also some swelling. And this one usually requires antibiotics. The other concerning potential reason for a single leg swelling is deep vein thrombosis, where a clot happens in the deep veins of the leg, and this usually the elderly person will have very severe pain over the calves or the hamstring, which is at the back of the thigh, the back of the leg, and this one is a very, very urgent problem. So to summarize, when an elderly person has leg swelling, it's often, if it's both legs, it's often a very common issue due to fluid retention, and majority of the cases are harmless. And if they want to pursue further, which is highly recommended that they do so, it can be done very easily with just a very simple examination and a blood test. Majority of the time is due to possibly the heart, the liver, or kidneys, if it's something pathological. If the elderly person presents with single leg swelling, this usually points towards a more urgent issue, and they should see the doctor as soon as possible. And to find out what the problem is, as I mentioned, it's very simple. Just a simple examination and a simple blood test will do. Thank you.
Click the share button to send this episode to a friend or a caregiver, and hit follow to keep up with our latest episodes.